Hello friends, today we will be talking about Down syndrome. Down syndrome is an autosomal trisomy involving chromosome number 21. In human body, the cell has 23 pairs of chromosome, out of which 22 pairs are autosomal and one pair is sex chromosome. So this involves an autosomal chromosome, hence it is called autosomal, and it is trisomy of chromosome number 21. That is, there is an extra one chromosome in chromosome number 21. Normally there are two N chromosome and there is an extra one chromosome, making the total 47 chromosomes in a cell. So there are other conditions which is due to autosomal trisomy, such as Patau syndrome, Edward syndrome, and the Down syndrome itself. It is due to the trisomy of chromosome number 13, it is due to 18, and it is due to 21. So I remember these three autosomal trisomy, which are most common trisomies and are frequently asked in exam and MCQs. I remember it as there is a football player named Pedro, and he wears commonly he wears a jersey number 13, 18, and 21. This is an imaginary football player named Pedro. That is P for Patau, E for Edward, and DO for Down syndrome, and he wears a jersey of 13, 18, and 21. And this is in ascending order. And in Down syndrome, trisomy occurs in 95% of cases. The Down syndrome occurs by meiotic dysfunction. In 4% of cases, it is due to Robertsonian translocation between chromosome number 21 and 14, most commonly involved. And in 1% of case, the trisomy is due to mosaicism. So what is the risk factor of developing a Down syndrome? The risk factor for developing a Down syndrome is the maternal age. That is, if the age of a mother is less than 20 years, then the chance of having a baby with Down syndrome is 1 per 1500 child. That is, out of 1500 child, only one child has a chance of having a Down syndrome. But if the mother child is greater than 45 years, then the chance increases by 1 by 25. That is, out of 25 children, one child has a chance of having a Down syndrome. And there are certain conditions which is related to the paternal aging, such as achondroplasia and Marfan syndrome. We can remember it as by MAP. Marfan syndrome, achondroplasia is due to paternal aging. So when you get a child with a Down syndrome, then there are certain features indicating towards that the child has a Down syndrome. So when we are on bedside and then we get a child with a Down syndrome, then we see certain features that point us toward that the child is having a Down syndrome or not. So in general, superficial examination, that is what we see normally from head to toe examination, there are certain things that are present and are classical for Down syndrome. And we remember these features starting from the hand, starting from the fingers, then moving on to the palm, then onto the head, that is brain, then on face, then we go to the neck, and on the pelvic region, and then on the foot. Then we complete our general or superficial features, and then we talk about the organ system involved in the Down syndrome. So let us start. At first, in hand, there are two features, that is clinodactyly, that is inward curving of the fifth finger due to the hypoplasia of the middle phalanx middle phalanx of the fifth finger. That is, the finger points inward. This is a fifth little finger. It is the middle phalanx is hypoplastic, so it curves inward. And another feature present on the hand is a single transverse palmar crease, also known as simian crease. There is a single transverse crease on the present on the hand, which is normally not present in the normal baby. From hand, then we move on to the head. Head means brain. In brain, brain means that is the tone in the baby is very low. That is, the baby is hypotonic. Normally, a normal baby with a good tone has a well flexed arm and limb, lower limb and upper limb are well flexed. But in hypotonia, it is not present. It is due to decreased tone, and there is a poor Moro reflex. And Down syndrome is the most common cause of genetic intellectual disability. It is a most common cause of genetic intellectual disability. So from here we go to face. 1, 2, 3. In face, the face is flat face. Flat face. Then we go into eye. Feature present in eye. There are 3 features present on the eye. There is an upward slanted palpebral fissure. That is normally when you draw a line between the middle and lateral canthus, it is nearly a straight line. But in case of Down syndrome, as the eye is slanted upward and the palpebral fissure is also slanted, and the upward slanted appearance look like this compared to the normal. The another feature present is a epicanthal fold. It is an extra fold present in medial canthus in upper eyelid. And in iris we can see a whitish spot known as Brosfield spot. Then in nose there is a hypoplasia leading to small nose with flat nasal bridge. So moving on to the ear. The ear are small and low set ear. That is, when you draw a line from the lateral canthus, certain part of the pinna lies above that line. But in Down syndrome, the ears are below that line. And there is a protruding tongue. Now we have finished the features present on the face. Then we come to neck. Neck is short. And we go into pelvic, where is the in pelvic region there is pelvic dysplasia, and in foot region there is a there is a wide gap between first and second toe, known as sandal gap. And last, there is a hyper flexible joint is present. There is a Hall's 10 cardinal signs. Hall's 10 cardinal signs that is used in the diagnosis of Down syndrome in the neonate. It comprises with clinodactyly, single palmar crease, hypotonia, poor Moro reflex, upward slanted palpebral fissure, short neck, low set ear, pelvic dysplasia, hyperflexible joint, 1, 2, 3, 4, 5, 6, 7, 8, 9, then 1, the last one being the flat face. Okay. The 10 feature, the Hall's 10 cardinal signs that is used in the diagnosis of the Down syndrome in the new one are clinodactyly, single transverse palmar crease, hypotonia, poor molar reflex, flat face, upper slanted palpebral fissure, low set ear, short neck, pelvic dysplasia, and hyperflexible joint. Now, after completing this general superficial feature, we move on to the organ system. In organ, a child with the Down syndrome, there is a 50% they are prone to have congenital cardiovascular disease. So CVS, they are 50% prone. Then organ system involved with GI and the neuro. In CVS, talking about the cardiac system, there is arterial septal defect, ventricular septal defect, patent doctor address is present, and tetralogia fallow is present. And talking about the vascular, as it is a child, mainly acute condition of the leukemias, that is acute lymphoblastic leukemia and acute myeloid leukemia is present. In GI system, listing them sequentially from esophagus, there is tracheoesophageal fistula. Then moving down, there is a duodenal atresia, annular pancreas, and in colon, due to the absence of ganglion, there is Hirschsprung disease, and in the anus there is imperforate anus can be present. In neuro, the patient can develop a seizure, and during the course of development, he or she may have a delayed development. Later may be present with autism disorder. Depression may occur in such child in later of age, and Alzheimer's disease Alzheimer disease, that is early onset Alzheimer disease is can occur, and it can occur as early as 40 years, because the gene known as amyloid precursor, the gene for the amyloid precursor protein, APP, is present in chromosome number 21, and in case of Down syndrome, as there is extra one chromosome in chromosome number 21, it is overexpressed. So and this protein is overexpressed, and amyloid precursor protein is a pathognomic for early onset Alzheimer disease. So now we move into the diagnosis of the Down syndrome antenatally. How can we diagnose the Down syndrome antenatally? For diagnosis in first trimester, in USC we can see a nuchal translucency. There is an increased nuchal translucency, that is the appearance of collection of the fluid under the skin behind the fetal neck. It is and there is an increased nuchal translucency, and there is a hypoplastic nasal bone that leads to a flat nasal bridge. And there are certain markers for Down syndrome. There is to remember this, we normally say markers for Down syndrome are high up. That is high are up. That is human choriogonadotropin is increased and inhibin is increased. SCG is decreased in other trisomy like Potava and Edward. Normally there is a mnemonics, that is the 5 A's of Down syndrome. I will like to enlist them and conclude this video. There is advanced mother age, atrioventricular defect, AML or ALL, Alzheimer disease early onset, and atresia, that is duodenal atresia. There is also one protein known as PAPPA, which is decreased in Down syndrome. PAPPA means pregnancy associated plasma protein. So this concludes the basic thing that you need to know about the Down syndrome, starting from the bedside clinical features that we need to know, Holstein cardinal signs, the organ system mainly involved, and the diagnosis in the first trimester. These markers are also tests are also done in the first trimester. So see you all in the next video. Thank you.